A great honor and privilege to be here this afternoon. I want to welcome you all to Yale China. Some of you, it might be your first time. Some of you are veterans here. I don't know all your faces yet because I'm pretty new myself. My name is Mike Packevicz. I'm the Director of Health Programs Interim, and I'll be the moderator this afternoon for Guojiao's talk. Just to bring your attention to a couple of things, you no doubt notice all the beautiful, whether you call them qipaos or cheongsams, they're really amazing. And the story behind them is quite a story, and it's told on the panels around the room. So as we go through as we wind up the afternoon, be sure to take a look at that. You might be thinking, well, why do you guys have a bunch of Chinese high-collar dresses? It's because of our connection to the Hu family and their connection to Yale China. Mary Hu Cho owned all these dresses, plus a number of other ones, and brought them out of China with her many years ago. And Mary's daughter is now at the School of Medicine, and her son Toby, I believe, is in Beijing right now. He's been one of our teaching fellows in Yale China, and so he's a volunteer.
Graduated yet.
Thank you. That's Lucy Young, our senior program officer in the health programs. And she corrects me when I say something wrong. But it's a really great story. They're really amazing dresses, so make sure you take a look at them before you leave this afternoon. And they'll be on further display, I believe. Is that right, Annie, wherever you are?
No, they were on display at the Cheongsam Ball.
They were on display last year at the Cheongsam Ball, yeah, okay. This year's Cheongsam Ball is going to be in New Haven again on February 13th. And for those of you who are calendar aficionados, you already know that that's a Friday the 13th, but we're not worried about it. It's going to be a great time. So if you've been before, you'll know that it's a really wonderful occasion. If you haven't been, we'd love for you to join us there in February. So at Yale China, we've been around for 113 years. Yale China was started in 1901 by a group of Yale graduates who wanted to see China further develop right after the Boxer Rebellion. And for over 100 years, we've been involved in health programs as well. And this year's an especial year in that we're celebrating the 100th anniversary of the Changsha School of Medicine in Changsha, a great milestone in Yale China's history and in healthcare in Hunan province. Doing things like that, starting a hospital, sending people to teach English, helping develop women professionals, all these things are about making connections, and really that's what we're about at Yale China. I just wanted to read a couple of things for those of you who are newcomers to Yale China. Our mission is to inspire people to learn and serve together. And our vision is that we see a U.S.-China relationship of mutual understanding and profound respect, nurtured by collaboration among individuals and institutions. So we're very much about making connections here. In the health programs, we make connections through nursing education, through the professional development of female health professionals, through the development of residency programs, at Xiangyang Hospital in Changsha and in Kunming and Western Hunan as well. In medical and resident student exchanges going in both directions, in medical ethics programs, and in HIV/AIDS adherence programs. And in all these things, we're making connections, not only between institutions, but also between people. One of the things we do here in town is that we make connections with some of our local community members. And one of those community members is the Amistad High School, which is just about 15 minutes from here, right? And every summer we have some interns who come here. These interns do a number of projects with us. They get a lot of professional development training. These are all, they're just high school students. But they really learn a great deal, or at least we try to teach them a great deal. And they do pretty well at learning it all. One of the things they have to do is to write a report on an influential person. And so the next young woman that I'll bring up did her report on a lady who has been involved with Yale-China. So now, Zuhlahat, if I could bring up Zuhlahat Hussein from Amistad High School. I'll just have her tell you for a moment about the connection that she made.
Well, it's nice to meet you all. When I came to Yale-China, I was a freshman. My school decided we had to pick out our interests, and it was either Yale-China or a law office. I like health in China, different cultures better, so I decided Yale-China was where I wanted to go. When I came here, I was a little nervous. I've never been in an environment where you have to work with other people. I mean, professional environment, yeah. My school is pretty strict on professions and how to conduct yourself in a business environment. But here, I was kind of shy that people wouldn't like me and I wouldn't know what to do. I'd mess up. It seems I had nothing to worry about since all the staff were friendly, and sometimes they cracked jokes to make me feel involved. So when it came to the final project, it was a long, difficult journey there. In the last 2 weeks, I was rushing. I didn't know who to do. No one seemed to, at first, call out to me until I decided to look into the stories instead of just the history of Yale-China, something more recent. So I picked Miss Guo since, well, she called the most to me. Her background on her father, and my mother has the same problem. She's a diabetic and she has high blood pressure. She had a cataract in her eye that made it so she couldn't see for a while through an eye. So your story really inspired me that you managed to take some bad experiences and work on it and try to improve until you're here. So it inspired me to, because I wanted to go into the medical profession too, and it inspired me to try and become a clinical laboratory scientist. So thank you. Great.
Hussein, meet Guo Jia.
Nice to meet you. Nice to meet you.
Great. Thanks, Zuhlahat. Now, whether those kinds of intentions or those kind of connections are intentional, or they're divine appointments, or in Chinese, yuanfen, any way we can make them, we make them. And so this was a great opportunity. Just a few weeks, not even 2 weeks after Zuhlahat did her presentation on Guo Jia, Nancy Yao Mosbach and I were out at an event in the San Francisco area for the Changsha Overseas Alumni Association barbecue. So who comes walking up to our table but Guo Jia? And everybody kept saying to me in China, oh, here comes Guo Jia, here comes Guo Jia, here comes Guo Jia. And the word Guo Jia in Chinese means country. So I was mishearing, and I kept thinking they're saying, here comes the country, here comes the country. I'm like, what are you talking about? And then I realized, oh! So it was great. We talked to her, and we found out that she would be in town at this time. And so we got her to come and do a fireside chat. So, Guojia, assistant professor Guojia, right? Yes. Comes to us with quite a long connection to Yale China. She got her Bachelor of Nursing in 2006, and then in 2006 and 2007, she was the recipient of a Yale China scholarship at Central South University School of Nursing. And so that was her first connection to us. She did her MS degree and then started her PhD, and she came as a Chung Fellow, which supported nursing education, and she worked with Professor Robin Whittemore, right? Yeah. In 2011, she got her PhD in nursing. The title of her dissertation was Theory, Study, and the Empirical Approach of a Conceptual Model of Childhood and Adolescent Adaptation to Type 1 Diabetes. Okay? I hope everybody got that. So it's great to see you all here. We're very excited to have her. She's been very accomplished. She's been hard at work publishing 10 papers? 20 papers. And a number of them with Yale colleagues. So it's very exciting to have her here to talk about some of this research on childhood adaptation to type 1 diabetes. So without any further ado, let me present Assistant Professor Guojia.
Thanks a lot for coming to my presentation. It's my great honor to present here. I think instead of saying it's a talk, I think for me, it's better for me to say it's a report to Yale China and to Yale University. I think I am sort of Yale graduate and Yale China graduate because I got, as Mike mentioned, I got my first scholarship from Yale China when I was a college, when I was an undergraduate student. Then I got the fellowship to study in Yale for a year from Yale China. So I just had a lot of connections with Yale China. So I think it's my duty to report my work here. Because this work, the whole research was developed at Yale with my advisor, Dr. Robin Whittemore. So it's my pleasure to report my work here. So first of all, I want to introduce a little bit about my university, Central South University. Our university is located in Changsha. In Changsha City, is the capital city of Hunan province. Our university is a very comprehensive university. It has 33 institutes and schools and 6 affiliate hospitals. Hunan province is in the central south of China. Look at the map. This is the map of China. The shape is looks like a cock, I think. This is cock's head, this is cock's tail, and our Hunan province is right at the cock's abdomen. So, as I mentioned, we fly to Beijing, Shanghai, and Hong Kong, all by 2 hours. And our university has 33,000 full-time undergraduates. It's a huge university. And as Mike mentioned, our Xiangya School of Medicine is celebrating 100th anniversary very soon, in a couple of weeks. And I'm happy I'm going back to celebrate this event. And Yale Xiangya School of Medicine was also founded by Yale China. And Yale China also funded our first Xiangya hospital. This was the old building of the hospital, and this is a very new building. and we also have other affiliated hospitals. And because I'm from Changsha School of Nursing, so I want to mention a little bit about this. Our school was also founded by Yale-China Association in 1911. So we have already celebrated our 100th anniversary in 1211. And this is our old school over 100 years ago, and this is our new school. And our school has 550 full-time undergraduates. And we have a very good relationship with Yale University and the UCLA, UCSF, and the University of Toronto, many international cooperations. About myself, my education program, I think is quite boring. Because I got my bachelor, my master, and my PhD all in the same school and all in the same major, nursing. So it's really boring. And but I was so lucky, and I got two international study experience. The first one is my when I was a doctoral student, I had a 1 year wonderful time and productive time in Yale, and now I am doing my postdoc training in University of California, San Francisco. So that's why I met Mike and Nancy as Changsha alumni, the barbecue. So I didn't imagine about this. So I'm so happy to come back. It's like my home. And I said before in my farewell party 6 years ago, and I said New Haven is my second hometown. I will for sure come back again. And my research experience focused on type 1 diabetes management and diabetes prevention. So since I'm sort of young, so I don't have too much research experience. So, but these 4 projects I have already touched and do some work on these 4 areas. The first one is childhood adaptation to type 1 diabetes in China. This is exactly my dissertation work. And now we are doing a pilot of coping skills training for Chinese youth with type 1 diabetes. That's what I am, Dr. Whittemore and I are doing this project. And it's just get funded, so got funded, so we were happy with this. And now so for the other direction, I would like to do more about the diabetes prevention for type 2 diabetes for prevention work. I think I'm also interested in that because type 2 diabetes is a very big health issue in China now. So my year study experience, I will for sure to mention it. So I primarily work with Dr. Robin Whittemore and Margaret Gray. Both of them are leading experts in type 1 diabetes care. So I was so lucky to work with the best team in this area. I only want to mention this picture is from my farewell party. A lot of memories. Then I'll go to my topic now. And so as you know, diabetes is now a global health issue. We have in the world, for the whole world, we have 32 million of people with diabetes, and about half of them are undiagnosed diabetes. That's very impressive. And our country, China, has the largest diabetic population in the world. As you know, China has a very large population, But in the 3 years ago, India was the largest diabetic population country, but now it's China. We have 98 million people with diabetes, and our incidence of diabetes in China is about 9.72%, and in the US it's around 11%. So diabetes caused 5.1 million deaths in 2013, and every 6 seconds a person dies from diabetes. So it's just a very serious health issues in the world. So as I mentioned before, I talked about type 1 diabetes and gestational diabetes and type 2 diabetes. So I want to give you a little bit background of the differences between those types of diabetes. As a normal situation, our pancreas secretes produces insulin to bring our blood sugar down. So the blood sugar will go into our cells. Then the blood sugar will be brought down. So that's a normal situation. So for type 1 diabetes, there's for any reason there's something wrong with our pancreas, especially the beta cells. It cannot produce insulin anymore. So our blood sugar will be extremely high without extra insulin from outside. But for type 2 diabetes and gestational diabetes, our pancreas can also produce the insulin normally, but the problem is the receptor. Our cells cannot react normally to insulin. That's we have plenty of insulin, but the cells cannot recognize the insulin, and so the doors cannot open, and more sugar will stay in the blood. So that's the differences between those types of diabetes. And type 1 diabetes, because as I mentioned, because the beta cell from our pancreas cannot produce insulin anymore, so there's no insulin in our capillary, so it cannot bring our blood sugar down. In summary, about 5 to 10% of all cases of diabetes is type 1 diabetes, and it's the most common and serious metabolic disorder of childhood. So type 1 diabetes is a childhood onset disease, not like type 2 and gestational diabetes. That's onset in adults, especially in older age. And type 1 diabetes has potential for long-term lifestyle complications. The characteristics of epidemiology of type 1 diabetes in China is quite impressive to me. Was quite impressive to me because it has very, very low incidence of type 1 diabetes in China. But because we have a large population and the number of type 1 diabetes use is huge, I think, and the incidence is decreasing. Look at this blue blue line, and our incidence is really low. That might be the reason that our health providers did not pay enough attention to this group of patients. And this is just a description of our diabetes complications. And compared with Western countries, in Chinese population has more microvascular complications. We have more complicated. It's like our eye problems, kidney problems, and prehumeral nervous system problems. It's not like Western country. And all the type 1 diabetes patients has to get the extra insulin from outside. So they have to inject insulin in their whole life. So they are so type 1 diabetes is a childhood onset, and all the kids have to take insulins for the lifelong time. So it's quite impressive to all the families and the kids. And the recommended treatment regimen is quite complex and high required. Not only taking the insulins, but they have also to manage their physical activities, diet, and do some carbohydrate intake counting. So it's very complicated for young people and the kids. And the other situation we found when I did the literature review, we found few studies have been reported on adaptation to type 1 diabetes in China. So we set up our research aims for my dissertation, and my dissertation work is focused on the 5 aspects, 5 domains, and it has been quite productive. I had 8 papers published from my dissertation data, and 5 of them are published in English and working with Dr. Whittemore and Dr. Green. So in the following process, I will talk about my major finding from my dissertation work. As everybody who first did their research, the first step is to do a literature review. So when I did the literature review, I found some interesting findings. First, we are very interested in the relationship between diabetes self-management and metabolic control. And we found the research is conflicting, and there's little systematic review of the literature. So we did this literature to figure out whether better diabetes self-management can get a better metabolic control. That's our hypothesis. So we did this systematic review. Those are articles we reviewed. Then finally we found more longitudinal studies showed significant positive relationship between diabetes self-management and metabolic control. And the significant positive results are more founded in studies where the youth mean age was over 13 years old. And we also found a few factors influencing this relationship, like the design of the descriptive study and the child age and the various measurements of self-management. This is our major finding from the literature review, and this review was published in peer-reviewed journal. After we did this review, we found there are a few sensitive measures of self-management from the previous studies. We found that one of the instruments was really good and was very comprehensive to describe the definition of diabetes self-management. That's our second step of this research. The second step is we translated that self-management measurements, the tools, and did and tested their psychometric properties in Chinese youth with type 1 diabetes. The tool is the name of the tool is the self-management of type 1 diabetes in adolescents. Actually, this tool was developed by Yale professors from School of Nursing, and this paper was also published. So this is what I did to translate this instrument. We did forward translation, back translation, and equivalence evaluation. So the process is really complicated. Was really complex, and it took me a year to translate only translate the instrument. And I circled the 2 steps because I want to acknowledge the Yale-China staff because they helped me with back translation and the problem items figuring out, because they are bilingual experts, and they are Bill Pen and Hong Ping Tian. I only want to acknowledge them. Then after we translated the instrument, we got very good results from the expert panel for the translation equivalence. Then we did the psychometric evaluation in 136 youths with type 1 diabetes in Hunan province. This is the characteristics of the sample. And we found the Chinese version tool had good reliability and validity. Therefore, we think this Chinese version tool has the potential to provide nurses with a useful, reliable, and valid tool for clinic assessment as well as international research comparison. Because we have English version and the Chinese version, we can do some comparison work. It's a transcultural research base. And then when we did when we developed the proposal, we found we need a theoretical model for our research. Then we selected a very good model which can fit our research idea. That's the childhood adaptation model to type 1 diabetes. But we found that model, although that's a very good model, but that model was developed 20 years ago, and considered research has been completed. So we think that model should be adapted. This is the original model, and we made some change to the model from the terminology, from the additional variables we should add to some elements in that model, and we also add more recursive pathways to this model. So we got the updated new model. And the new model can have some very good research and clinical implications to future research on promoting childhood adaptation to type 1 diabetes. This paper was also published. This is our collaborative work. After we get the model, we got the model, it's necessary for us to test or evaluate the model in real persons, because that model was adapted by systematic literature review and our previous research experience, and almost all the literature was from Western countries. Whether the model can use in Chinese population is unknown, so we think it's very necessary for us to test this model in Chinese population. So we did this, and there are many variables in this model. It's not possible for us to test every variable in a single study. So we only selected very important variables we are interested in from the four major elements of the model to test in our Chinese population. We used a multi-site longitudinal descriptive study, and we tested the variables I circled in red, and so at the baseline we got 136 eligible Chinese youth, and we followed 86 of them for the second time. So that's our methodology. This is our result, and this is we found the mean hemoglobin A1C level was 9.68%, and the normal A1C was less than 6. So and we found their metabolic control was poor, and they had very high depressive symptoms, and their self-management was not very good, and the quality of life was worse than normal than healthy peers. And we also explored some influencing factors of diabetes self-management and the influencing factors of depressive symptoms. So from our baseline data, we think living with type 1 diabetes in China poses considerable challenges for youth and their families, such as poor diabetes self-management and high depressive symptoms. There is a great need for culturally relevant interventions aimed at improving metabolic control and psychosocial outcomes. Then we followed up 86 youth with type 1 diabetes from our baseline data, and these 86 patients showed a decreased trend in diabetes self-management, but there are other major variables are stable. And we also found the increasing diabetes self-management can affect the change in metabolic control in Chinese youth with type 1 diabetes. And we also found an increase in depressive symptoms over time was associated with poor quality of life satisfaction in this sample. From our longitudinal data, we can make this conclusion. Improving diabetes self-management and depressive symptoms could possibly enhance both metabolic control and satisfaction with quality of life. So after we get the full picture of the childhood adaptation to type 1 diabetes in China, the next step is to do the intervention, because we have already know their situation. We know what they need. Then we can develop a very good intervention for them to help them adapt to type 1 diabetes better. So I just adapted coping skills training for type 1 diabetes. This work was Dr. Margaret Grace's famous work. I adapted it, and I want to translate it into Chinese and to use that in our Chinese population. So this is only a pilot study. Our whole idea is for coping skills training, we want to improve the mediators. The mediators included self-management, coping, and self-efficacy. That's what we want to improve. Improve these variables can affect the adaptation outcomes, including metabolic control and quality of life. This is our whole idea of this intervention. And this pilot was aimed to modify and culturally tailor the US version of coping skills training, and we also want to test the feasibility and acceptability of coping skills training in Chinese population. How to modify the coping skills training manual is very important. So we plan to do 3 rounds of our modification. We have already done the first modification, and we are going to pilot this study. Then we will get the 3rd round of modification. For the first and the second round, we focused on the content. And this is the original coping skills training sessions. From our previous study results, we added blood sugar management into these sessions. And we also did the cultural adaptation for some, actually we don't find many cultural problems between the 2 versions of manuals. So we just made some minor changes, and we sent this to expert panel to evaluate the quality of the optional manual. The results was very good. We also did some modification on the structure. The original coping skills training has many sessions, and they have to do contact with patients weekly or twice a month. But it's not working in China. All the because we have very low incidence of type 1 diabetes, all the patients are supported all over the country and all over the province, and many of them live very remote rural area. It's not working for them to come to Changsha to see us to do the intervention. So we just condense this to 3 longer sessions via our summer family camp for this use. But we will do more telephone booster for them to keep adherence of them. This is the inclusion criteria and the exclusion criteria. And this coping skills training in China will be only 3 days, and but all the kids will stay together in that camp and with their families, and we will do that sessions half a day, so 3 days. We will evaluate these variables. Those variables were showed in that model. After we pilot this study, we will do focus groups to either the research assistants or the youth who participated in our study. Then we will make the final change of this intervention. Then hopefully we will get this Chinese version of coping skills training program ready for the large randomized clinical trial. So my future research is to do the large randomized clinical trial, and then finally translated this research to clinical practice. Finally, improve the health of, improve the childhood adaptation to type 1 diabetes in China. I think that's all my research and my future research idea, and your comments and suggestions are appreciated. Thank you very much for coming.
So our fireside chats are meant to be very much a conversation. So we have, I think, a lot of health professionals in here. So we just want to open up the floor at this point, if you have comments or questions. Yes, Steve.
Do you go into the pharmaceutical end of this also? In other words, how medicines are used to treat some of these the diabetes children?
Pharmaceutical?
Yeah.
I didn't go to the pharmaceutical to find better.
Well, in other words,
medicine.
whether medicines can also be useful in the treatment of the type 1 diabetes children.
Actually, for now, for current situation, we only use insulin, no other medication.
Are other medications available?
Not really.
Okay.
Yeah, only insulin.
Yeah, good time.
Thank you so much for your wonderful presentation. And I'm interested in the modeling, the model updates. Can you talk a bit more about the model updates?
What aspects do you want to hear? Actually, yes. First, when we did the literature review, we just found more and more current research come out, but the model did not describe them, especially some variables like eating disorder for the youth with type 1 diabetes. So we think we should update this model, and then we just did it and want to test it.
Okay, well, one comment, one question. First, I want to elaborate about something about the treatment against type 1 diabetes. You just mentioned because type 1 diabetes treatment is compared with type 2, it's pretty simple because that kind of insulin deficiency is absolutely deficiency. Not like type 2 diabetes. Type 2 diabetes is a relative deficiency. It's because of the peripheral tissue resistance to insulin, right? So the treatment is just it's kind of insulin replacement, right?
Yes.
So even that professor just mentioned the treatment. I have no much choice. No much choice
No
to
much choice,
treat
but
the
you-
type 1 diabetes. Even you just it's acting time. Some may be within 5 minutes, some even 30 minutes, some even can last a longer time, right? So actually, no much choice. We just replace, supplement usually, right? That's
Yeah.
a comment.
Yeah, replay.
And the question is, I'll make some. It's about the epidemiology of type 2 diabetes. And you mentioned in your PPT, the type 2 diabetes in China, the total type 2 diabetes population is about 98.4 million, right?
Yeah, that's the whole diabetes.
Whole
population,
diabetes population.
including type 1, type 2, and gestational.
Yes,
and
exactly,
others.
no problem. But I found that the incidence rate is more than 10%,
Yes. No, 9.72.
almost 10%.
Yes, almost.
So, is this older population or just adult population? If it's adult, just adult population, consider it. That makes sense. If that's older population, the population size should be much more, should be larger than the 98.4 million, right? Because China population size is 1.3 billion,
Yeah.
and the times almost 10% should be more than 100 million.
That's only adult.
Yeah.
Yeah.
So because if I'm right, you should get the data, if there without the epidemiology data of this PPT from the New England Journal of Medicine
Yes.
journal.
Yes.
It's published 2010, right?
Yes.
And all the research maybe have done by Chinese scholars. And our second Shanghai Hospital Department of Endocrinology
Yeah.
also is one center.
Yes.
It's a
I know.
multiple center
Water
research,
size. Yeah,
right?
Yeah, water size research.
So you should just say that's the adult population.
Yeah.
It's about 18 years old. About 18 years old. Older than
Yeah.
18 years,
Yeah,
the
yeah.
population, right?
Yes. The
That's it.
adult population.
Yeah. Thank you.
Thank you.
I'm just wondering, what are some of the cultural or social barriers that you're finding to diabetes management? Such as, are there any stigmas attached to having diabetes?
Yeah, that's a wonderful question. And the incidence of type 1 diabetes is really low in China. So we have few patients with type 1 diabetes. So I think there is a stigma of the families to being diabetic patients or families. So some of the very poor family, they are less educated, and they think they don't want their kids to get their insulin shots in school. So that's one problem. And in my country, some of the poor family, they cannot send the kids to very good schools, and there's no refrigerator, and they have to stay at school. So they think it's not working. Either they will take the kids home, and they think you are so sick, you will have danger for your life. So you must stay home, and you are not going to school. This is one option, and the other option is just send the kids to school without any insulin shots. Yeah, that's very complicated. And in China we have one child policy, and every family, most of the families can only have one child. If the child is getting sick, the parents can have another child, but they just don't care more about the feelings of the first sick child. because all the other classmates they only have one child, but because I am sick and my parents have two, and my love was divided to two, so the kids just some of them feel horrible, and so the incidence of elevated depressive symptoms is very high in my study sample.
Thank you.
Yeah, thank you.
Would that mean that there's a lot of unreported cases of diabetes? Unreported.
Unreported. Yeah, I think so.
I mean, from what you were just saying.
Yeah, because the incidence was from many years ago. That's very low. But we don't have new data, the epidemiology data for type 1 diabetes population, and our Chinese Diabetes Association just ask advocates people to do more epidemiology research on type 1 diabetes, because we have no data.
But it's not likely to be unreported because the child would die without the insulin. It's the type 2 diabetes that's unreported.
Right. But if they don't, well, maybe not unreported as much as untreated.
Or not treated well.
Not treated well.
Treated
If
poorly.
they're, because they're supposed to take, like, say, 4 insulin shots a day. If they're not bringing their insulin to school, that could be two doses of the medication that they're not getting. So it's
Would be probably
undertreated, right?
And the diagnosis in local hospitals in rural area was very bad. They cannot diagnose. So even they get very sick in hospital, they just cannot diagnose.
To come back just for a moment to the parents and the kids' relationship about diabetes, one of the things that I thought was very interesting as I was doing some reading to get ready for this was that the conflict between the parents and the kids around diabetes management had a very significant effect on both the self-management and the metabolic control. So can you say a little bit about that conflict and how that affects the process?
Yeah, that's a very serious problem, especially for teenagers. And they are very special age group, and they just don't want to. First, they think my life was ruined because of this disease. It's a lifelong disease, and I am so young, and I'm dying maybe very soon. That's what they think. When the parents, the parents Chinese parents just care very much about the kids, and they protect them very well. I think too well, and they just don't want people to disclose their disease, and just don't want this and that. Don't let the kids go to go camping or go other people's birthday party. So, but the kids want to go. So there are a lot of conflict heads, and some kids they just don't want to stay in that situation. But the parents wants them to do this. You are not going to eat so much, and you are not going to eat sweet drinks, and so on. So they have a lot of conflicts, especially in teenagers.
So the kids just feel like, I'm not going to do this anymore.
Yeah, some kids they get the eating disorder. They just eat very much, and because the parents may not allow them to go to school anymore. I found some girls, especially girls. Yeah, she sent me a message and she said, I think I'm going to die, and I don't want to do that anymore. Yeah,
We have time for one last question.
I'd be curious for you to talk a little bit about how your research process went. Like, was it easy? Do Chinese children and their parents want to participate in research or not?
Yeah, that's a fabulous question. I had very hard time in collecting all the data. You know, we have very low incidence but I think this gentleman is from Second Changsha Hospital. First, okay. So my work was collected with Second Changsha Hospital. They have a very big type 1 diabetes center. They have a lot of data of the patients and their contact information. But when we called them, most of the telephone number was not existing anymore. And when we get to talk to the kids, some parents think we are just liars, or we just cannot come, and they just rejected us. So it has been very, very hard for us to connect with them. And myself and one of the master students in our school even went to very far and very remote rural areas to only collect one patient, to visit their homes and to make sure they trust us. And we brought our a portable A1C taster and our questionnaires and visit them very far away. We took a 12 hours night bus to get their remote village, then take another maybe motorcycles to get their home. So it has been very hard. So although I got more than 20% attrition of the follow-up assessment, I think I tried my best. We tried my best to collect this data, and there was no data on this area in China in the past few years. So I'm proud of my job, my work.
Well, Guojia, thanks so much for coming here. It's a serious problem all over the world, type 1 diabetes, and we appreciate the work that you're doing to translate what's been done in the West into the Chinese situation. We want to thank all of you for coming as well. I want to just remind you of a couple of things. If you haven't already, please sign up for our mailing list before you go out. It's right on the table in the other room. Again, our Changsha Ball is on February 13th, and everybody is welcome there. Yeah, thank you. Of course, we don't want you to just bolt out of here. Stick around, have a few more cups of tea, a few more snacks. And last but not least, just as a way to say thank you to Guojia for doing the Fireside Chat today. Here you go.
Thank
Thanks
you
again.
very much.
Very
Thank
much.
you very much.